aspect of relatedness, seeing someone that you can identify with makes a big difference. And as a surgeon who frequently has to perform emergency surgery, that whole aspect where the patient has to sort of trust you immediately, it does make a difference. They tell you more. If they trust you, they will tell you things that they won't necessarily tell to another practitioner. My name is Dr. Raymond Wedderburn, and I'm the Chief of Trauma and Surgical Critical Care at Mount Sinai St. Luke's.
So from your medical perspective, why is diversity, equity, and inclusion important in healthcare?
Well, I think it's important because healthcare, unlike many other enterprises, it's so uniquely personal, and identification with a provider, I honestly believe makes a huge difference. As a surgeon, I see it every day, and also in my work with trauma patients. For patients when they're ill and most vulnerable, they do tend to regress, and I occasionally will see someone who, they speak to me only in Spanish on day one, who 3 days later they actually do speak English. So that regression is something that actually occurs. And when the patient sees someone who actually looks like them, who they can identify with, I think they tend to be more comfortable, and they respond differently. They tell you things that they might not otherwise tell you if they did not feel as comfortable with you. So I think at the end of the day, it's important because there's a much higher likelihood of buying, of believing what you're telling them. And so having someone who they can truly identify with, make them feel truly comfortable in terms of sharing these things that are deeply personal. And I think that's pretty important in terms of trying to make sure that we provide good care for all our patients.
Have you ever had an incident where diversity inclusion played a role in the care you provided to a patient?
I remember one day we're making trauma rounds, and we have someone who covers at night, someone who covers during the day. And I had never met this patient before, but the sign out I received was that the patient had dementia. And I remember walking in the room, and of course, you kind of take what you're told at face value. I walked in, and it was the B bed, so it was the bed by the window. And I remember I saw the patient, and it was she's an elderly white woman, or so it appeared. And in usual fashion, I said, good morning, I'm Dr. Wedderburn, we're making trauma rounds. She responded, and my first thought was, that's an interesting accent. So I asked her another question, now sort of thinking about this dementia piece, and she answered appropriately. And so I asked her several other questions, and her answers were absolutely appropriate, not consistent with dementia. However, her accent was this heavy Jamaican accent. It was virtually, unintelligible unless you understand the accent. I'm Jamaican myself, and so I turned to the team and said, she's not demented, she's Jamaican. And there was some embarrassment. I think it's a situation where obviously no one meant to treat the patient inappropriately, but there was a disconnect because there wasn't that connection that this lady could be Jamaican and was speaking with a heavy accent. It's the whole concept of having people from different backgrounds who might actually pick up something that otherwise would be missed. The interesting piece of that, of course, is that, here's someone who is completely normal from a mental status standpoint, but because of her speech or dialect, she was being inappropriately labeled, and that certainly could have affected her care. Again, there's nothing intentional. The reality, though, is that these things are going to occur unless you have diversity in people who, from different backgrounds, who can actually bring something else to the table. And so I think it's really important to have diversity and inclusion to ensure that actually patients feel comfortable and feel that it's a situation where they can share many things that are obviously deeply personal.